Hello, and welcome to Health 60 Plus. If you are 60 years old or older, this message is for you. As we enter this stage of life, we often notice subtle changes. A little more stiffness in the knees, a slight decrease in energy, sleep that is not as deep as it used to be, occasional aches in the back or shoulders. These changes are natural. Our bodies have served us for decades. Now they ask for a bit more care and attention. In this video, we will focus on 5 essential pillars of health after 60: gentle movement and physical activity, balanced nutrition for strength and vitality, restful sleep and stress management, regular health monitoring and preventive care maintaining, mental well-being. By understanding these principles, you can establish simple daily habits that support your overall wellness. Later, we will provide detailed instructions on specific exercises to keep your body flexible and strong. For now, let's explore the foundational concepts. 1. Gentle movement and physical activity. As we age, our muscles and joints naturally lose some of their strength and flexibility, but even small amounts of movement, performed regularly, can bring remarkable benefits. Preserve muscle tone. Even, brief, gentle activities help your muscles stay engaged. Over time, this reduces weakness and fatigue. Maintain joint mobility. By moving your body each day, you encourage healthy circulation of fluid in the joints. This helps reduce stiffness, improve balance and coordination. Taking a few minutes each day to stand, shift weight, or walk slowly helps reinforce the signals between your muscles and brain. This lowers the risk of falls, boosts circulation and heart health. A short daily walk, indoors or outdoors, gently, raises your heart rate and strengthens your cardiovascular system. Fade the fog of sedentary behavior. Sitting for too long can lead to aches and increased stiffness. Taking a moment each hour to stand, stretch, or walk can keep your body fluid and your mind alert. Key point: you do not need an intense workout. You do not need to run marathons. Simple, light activity, such as a comfortable walk, gentle stretching, or seated movement, performed consistently, will help maintain your strength, flexibility, and balance. Later, we will release a detailed exercise routine tailored for those aged 60 plus. But for now, remember, the goal is daily, gentle movement. 2. Balanced nutrition for strength and vitality. Nutrition after 60 focuses on quality rather than quantity. As metabolism slows and muscle mass decreases, it becomes crucial to choose foods that deliver maximum nutrients. Build a balanced plate. Aim to fill your plate as follows: half with colorful vegetables and fruits. Vegetables like leafy greens, carrots, broccoli, bell peppers. Fruits like berries, apples with skin, and citrus. These provide vitamins, minerals, fiber, and antioxidants. 1/4 with lean protein. Sources include poultry, chicken, turkey without skin, fish, salmon, mackerel, trout, plant-based proteins, beans, lentils, tofu. Protein is essential for maintaining muscle mass. It helps repair tissues and supports immune function. 1/4 with whole grains, brown rice, quinoa, oats, whole wheat bread, or pasta. These carbohydrates supply sustained energy and fiber, which helps regulate blood sugar and digestion. A small portion of healthy fats. Choose unsaturated fats: olive oil, avocado, nuts, seeds. These fats support brain health, reduce inflammation, and help absorb fat-soluble vitamins A, D, E, K. 2.2. Hydration is key. After 60, your sense of thirst may diminish. To keep your body functioning optimally, Aim for 6 to 8 cups of fluid daily. Water, herbal teas, caffeine-free, clear broths. Keep a water bottle nearby. Sip throughout the day, even if you do not feel thirsty. Limit caffeinated drinks. They can act as a diuretic. Avoid sugary sodas or excessive sweetened juices. 3. Prioritize nutrient-dense foods. Some foods deserve a special place on your table. Leafy greens and cruciferous vegetables, spinach, kale, broccoli. Berries, blueberries, strawberries, raspberries, rich in antioxidants. Fatty fish, salmon, sardines, mackerel, source of omega-3 fatty acids. Greek yogurt or low-fat kefir, probiotics support gut health. Nuts and seeds, almonds, walnuts, chia seeds, flax seeds, offer healthy fats, fiber, and protein. Mindful portion control. Because energy needs decline with age, oversized portions can easily lead to unwanted weight gain. Try these strategies. Serve meals on smaller plates. Chew slowly. Pause between bites. Listen to your body. Stop eating when you feel comfortably full. If you dine out, consider sharing an entree or immediately setting aside half. By focusing on nutrient density, proper portions, and regular fluid intake, you give your body what it needs to thrive. 3. Restful sleep and stress management. Quality sleep and effective stress reduction go hand in hand with overall health, especially after 60. 1. Understanding sleep changes. At this age, you may notice difficulty falling asleep, more frequent waking during the night, lighter, less restorative sleep. To improve sleep, stick to a consistent schedule. Aim to go to bed and wake up around the same time daily, even on weekends. Create a calm environment. Keep your bedroom cool, 65 to 68 degree temperature. Use blackout curtains or an eye mask. Reduce ambient noise. Use white noise or earplugs if needed. Limit screen time before bed. Turn off TVs, phones, and tablets at least 30 minutes before sleep. The blue light from screens can suppress melatonin production. Develop a relaxing pre-sleep routine, gentle stretching or deep breathing. Exercises. Sip a warm herbal tea, chamomile, lavender. Read a physical book or listen to soft instrumental music. Simple stress reduction techniques. Chronic stress can worsen blood pressure, increase inflammation, and disturb sleep. So, it's vital to find calming practices. Mindful breathing, 1 to 2 minutes. Sit comfortably with feet flat on the floor. Inhale slowly through the nose, count to 4, hold for 2 counts. Exhale slowly through the mouth, count to 4. Repeat 5 cycles. Guided imagery, 2 to 3 minutes. Close your eyes and imagine a peaceful scene, a quiet beach at sunrise, a shady forest glade, or a calm mountain lake. Use your senses. Feel the warm sand. Hear gentle waves. Smell fresh pine. Breathe in calm. Breathe out tension. If the mind wanders, gently return to the scene. Progressive muscle relaxation, PMR, 3 to 4 minutes. Sit or lie down comfortably. Starting at your feet, tense calf muscles for 5 seconds, then release. Move to thighs. Tension for 5 seconds, then release. Continue upward, hips, abdomen, chest, shoulders, arms, hands, neck, face. Notice the contrast between tension and relaxation. Incorporate one of these techniques into your evening routine and watch how your stress levels slowly ease, helping you achieve more restful sleep. 4. Regular health monitoring and preventive care. Early detection of health issues often makes treatment simpler and more effective. Schedule annual physical exams. Blood pressure check. Ideally, under 130 to 80 mmHg, check at least once a year, or more often if you have hypertension. Blood tests. Fasting blood glucose. Under 100 mdl is normal. 125 mdl indicates prediabetes. A1C under 5.7% is normal. 5.7, 6.4% indicates prediabetes. Lipid panel, total cholesterol, LDL under 100 ml/dl, HDL above 40 ml/dl, men, or 50 ml/dl, women, triglycerides under 150 mdl, body mass index, BMI, aim for 18.5 to 25, if possible. Measure waist circumference. Under 40 inches, men, under 35 inches, women, to lower metabolic risk. Bone density scan, DEXA, recommended for women at age 65, men at age 70, or earlier if risk factors, family history, previous fracture. Cancer screenings as recommended. Discuss with your doctor which screenings you need and how often. Colonoscopy, every 10 years if normal or more often if polyps were found. Mammogram, every 2 years for women aged 50 to 74, or as advised. Prostate exam, PSA test. Discuss benefits and risks with your healthcare provider. Skin check, yearly dermatology exam for skin cancer risk. 3. Vision and hearing checks. Eye exam, at least every 1 to 2 years, or immediately if you notice changes, blurry vision, frequent floaters, glare, difficulty seeing at night. Hearing test, at least once a year, especially if you find yourself raising the volume on the TV or phone or struggling in noisy environments. 4. Dental and oral health, dental checkup and cleaning every 6 months. Healthy teeth and gums support good nutrition. Poor oral health can contribute to systemic inflammation and increase cardiovascular risk. At-home care. Brush twice daily with a soft bristled brush. Floss gently once a day. Use an antimicrobial mouthwash if recommended. 5. Immunizations and vaccinations. Influenza, flu. Vaccine, annually, any dose appropriate for your age and health conditions. Pneumococcal vaccines, PCV 13, Prevnar 13, and or PPSV 23, Pneumovax 23 per CDC guidelines. These protect against pneumonia and other pneumococcal infections. Shingles vaccine, recombinant zoster vaccine. At age 60 or older, 2 doses, 2 to 6 months apart. Tdap booster, tetanus, diphtheria, pertussis. Once, if you did not, have it as an adult, then tetanus diphtheria booster every 10 years. Staying up to date on immunizations helps your immune system fight infections, reducing complications. 5. Maintaining mental and emotional well-being. Although our primary focus is physical health, mental health is deeply connected. A calm mind supports healthy choices. A positive outlook promotes healing. Stress and emotional health. In you have no major stressors. Everyday worries can accumulate. Health concerns, changing lifestyles, financial decisions, or feelings of isolation. Key strategies to support emotional health. Stay socially connected. Call or video chat with a friend or family member at least once a week. Join a club or group that matches your interests. Book club, knitting. Group, faith community, gardening club. If transportation or mobility is limited, explore phone and online groups. Practice gratitude daily. Each evening, write down 3 things you are grateful for. For example, I am grateful for my morning tea. I am grateful for my neighbor's smile. I am grateful for a good night's sleep. Reflect on why each thing matters. Engage in brief mindfulness or meditation. Even a 1-minute mindfulness break can make a difference. Sit quietly and focus on your breath, or notice the sensations in your body. When your mind drifts, gently bring it back to the present moment. Maintain a routine. Regular wake-up and bedtime support mental stability. Scheduled activities, walking on certain days, meal planning, checkups, help create predictability and a sense of control. Cognitive stimulation. Keep your brain active. Reading. Short news articles, magazine features, novels, or poetry. Puzzles and games. Crosswords, word searches, jigsaw puzzles, large piece styles if vision is limited. Learning a new skill. Try a simple craft, knitting, painting, or even basic computer skills. Local community centers often offer low-cost classes. Conversation and discussion. Talk about current events, family stories, or shared memories. Discuss topics with friends to keep your mind engaged. Regular mental exercise supports memory, focus, and problem-solving abilities. 6. Putting it all together. Building daily habits. To create a sustainable routine, choose small, realistic steps you can repeat daily. Sample. Daily health checklist. Morning hydration. Upon waking, drink a glass of warm water. Gentle movement. Do some light activity. Stretch, walk for 10 minutes, or do seated movements. Detailed exercise routines will come later. Balanced breakfast. Include protein, whole grains, and a fruit or vegetable. Example. Oatmeal with berries and a spoonful of Greek yogurt. Midday, hydration and snack. Sip water throughout the morning. Have a healthy snack, handful of nuts, a piece of fruit. Lunch, balanced meal. Half plate of salad or steamed vegetables, quarter plate lean protein, grilled fish or beans, quarter plate whole grain, brown rice or whole wheat bread. Afternoon movement. Break. Take a short, gentle walk or do seated leg lifts if you cannot walk. Mid-afternoon, snack and hydration. Sip herbal tea or water. Enjoy a small yogurt, a few whole grain crackers with peanut butter, or raw vegetables with hummus. Evening meal, light, nutrient-dense dinner. Example, baked chicken with steamed broccoli and quinoa. Wind-down routine. Dim. Lights at least 30 minutes before bed. Practice 2 minutes of mindful breathing or guided imagery. Write down 3 things you are grateful for. Sip a small cup of herbal tea. Consistent bedtime. Aim to be in bed by 9:30 and 10 p.m. Turn off screens at least 30 minutes before sleep. Point 2. Weekly and monthly checks. Weekly. Weigh yourself once a week. Same day, similar clothing. Check blood pressure at home if you have a cough. Record the reading. Spend time on a hobby or social activity. Call a friend, attend a community event. Monthly. Review your spending on groceries and dining out. Ensure you buy nutrient-dense foods. Check your cupboard for expired food. Keep your kitchen organized. Plan meals and snacks for the upcoming week. Include variety and balance. Point 3. Keeping a simple health journal. Journaling helps you stay mindful of your habits and progress. Include daily movement. Walked 15 minutes this morning. Meals. Lunch, salad, grilled fish, brown rice. Sleep quality. Slept 7 hours, felt rested. Hydration, drank 8 cups of water. Mood, stress. Level. Felt calm after evening breathing exercise. Review your journal weekly. Celebrate successes. Note areas for improvement. 7. When to seek professional help. Self-care is powerful, but sometimes professional guidance is necessary. Contact a healthcare provider if you notice persistent or worsening pain, joints, back, headache, sudden weight loss or weight gain without reason, difficulty breathing or chest pain, frequent falls or dizziness, worsening memory or confusion, persistent changes in sleep that affect daily life, mood changes that last more than 2 weeks, sadness, anxiety, loss of interest. Regular checkups and open communication with your doctor help you address issues early. Do not hesitate to ask questions. No concern is too small when it comes to your health. 8. Conclusion and encouragement. You have the wisdom of experience. You have the strength to adapt. With a few simple, consistent habits, gentle movement, balanced nutrition, rest, stress management, and routine checkups, you can support your health and vitality after 60. Remember, small steps taken every day lead to big improvements over time. Gentle movement preserves strength and flexibility. Balanced meals nourish your body and mind. Restful sleep and stress reduction restore energy and calm. Regular monitoring catches issues early and guides appropriate care. Be patient with yourself. Progress may be gradual. Celebrate each positive change. Every extra glass of water, every balanced meal, every minute of movement. Health is a lifelong journey. You are not alone on this path. At Health 60 Plus, we walk with you, offering guidance, encouragement, and practical tips. Thank you for listening today. Stay committed to your well-being and embrace each day with hope and determination. Stay active, stay nourished, stay rested, stay well.